Hiya. Yeah, it was just a quick one. I saw a question in the chat about whether we're recording today or not.
Oh, yes, we will be. Yeah,
Oh,
we
it's
are
just
recording
literally
today.
just popped up. There we go. Thank you.
Thanks,
Thank you,
Charlotte.
Charlotte. That's a team effort. Okie doke. So from the national perspective, Steve, you wanted me to quickly update in relation to the slide packs from the annual conference. So they're now available to view and download from our carers workspace on the Futures platform. And the learnings from the conference and the outcome slides and videos will be shared later this month. So that was one of the things we wanted to update from a national perspective. And then the only other thing that we wanted to just update on was Carers Week. So thankfully, Ellie's going to give us a very brief update on Carers Week. Over to you, Ellie.
Yeah, absolutely. So everyone's probably already aware we've got Carers Week coming up fast from the 10th to the 16th of June this year. And the theme this year, as set by the organising bodies, is putting carers on the map. From an NHSE response, we will be hosting twice daily webinars throughout the week, and then we will also have a weekend and possibly a couple of evening events that we will keep you posted on. The format for the week, we're going to be following the format as set by the DHSC, and we'll be covering topics such as health and social care, work and employment, younger carers, older carers, as well as mental health and well-being. So it should be a pretty interesting week of sharing best practice and hosting webinars. We're in the process of putting together the content for the week. So if anybody is aware of any sort of examples of best practice, any case studies, any projects that they think would be really sort of opportune to showcase during the week, please, I'll pop my email address actually in the chat box, and please do get in touch with us, because it would be great to hear about what's going on that we can use this opportunity to showcase. So it's a watch this space at the moment, Rachel. We'll be back in touch soon with more information.
No, it sounds great, Ellie. Thanks so much for the update. We've got Harriet who wanted to ask a quick question.
Yeah, it's just we've done a lot of work submitting some really good best practice examples to the recent ADAS Carers Challenge. So I'm wondering if you could use some of the information of that for your Carers Week best practice. Yeah, what you just said, because we've done a lot of that, like pulling together of examples of good practice. So we'd be happy for you to use it for that purpose as well.
Absolutely. The sort of purpose of the week is to showcase and shine a light on what's going on out and about in systems and regions and in trusts. So anything you have along those lines, please do send over to me, and we'll make sure we embed it into the week.
Great. Thanks.
Thank you.
Wonderful. Thanks so much. So already a minute over the agenda. So I'm going to move quickly into the first presentation. So Katherine Wilson, Head of Employment and Specialist Delivery at Carers UK. You're going to talk to us today about supporting carers in the workplace.
Yes, thank you very much, Rachel, for the introduction and for inviting me to participate. So I've just been asked really to set the scene a bit with a few headline national stats about carers in the workplace, a little bit about the Carers Leave Act, and also a bit about our work at Employees for Carers and how we help employers. And I'm just going to share my slides. And as I do so, I'm just going to mention also that I'm really delighted that my colleague in our team, Emily Lalonde, is also on this call. And Emily is our Employees for Carers account manager for NHS England's Employees for Carers membership. So it's great to have her with us too. So just going to start with a little bit, that's just in a nutshell about our work at Carers UK. I think you're all familiar with that, so I won't say much more other than that just in a very quick summary that we give expert advice, information and support to carers, connect carers so no one has to care alone, campaign together for lasting change for carers, innovate to find new ways to reach and support carers. And of course, one of the ways we're doing that is trying to reach out to you and colleagues in your networks to support carers together. So delighted to be here. Just a couple of headline stats about carers. Every day in the UK, 12,000 people become carers, astonishing number from our polling and research, including over 5,000 people in the workplace. And of course, caring can affect us at any time, but particularly when we're of working age. And I've been through that experience myself very very much over the last few years as a working carer. It takes on average 2 years for people to self-identify as a carer. So that's why many working age carers particularly don't know where to get information and support. So the role of employers is so important. Very striking as well about how likely it is that we are to become carers. So 2/3 of adults are expected to care unpaid for a family member or friend in their lifetime. Women have a 50-50 chance of caring by the time they are age 46. I'm well over that age myself, and I know that lots and lots of people are balancing work and care. Men also have the same chance by the time they are 57. So that's 11 years later, but still very much a working age for many people. Interestingly, more women than men also provide high intensity care at ages when they would expect to be in paid work. But we know it's an issue that does affect all genders. Impact of caring on work. So we know again from our research that at least 1 in 7 employees in any workplace is a carer, but of course in sectors like the NHS we know it's much higher, and we think that number probably underestimates it. 3 key impacts that get reported to us at Carers UK and through our Employers for Carers forum. First of all, evidence that if carers are unsupported, they can be working below their potential, reducing working hours or giving up career opportunities. Secondly, carers report they're twice as likely to suffer from stress if unsupported, and stress is a key reason that carers give up work or reduce working hours. And lastly, our striking figure here that 600 carers a day in the UK are giving up work to care. And we know that's often because they don't feel they've got any choice. It's not an informed choice. It's just they don't know where to turn for help, either in the workplace or outside. And of course, that has a huge impact on staff retention as well as for carers and their families. Just to highlight as well, carers' priorities for workplace support. So over all the years that I've worked in this area and with Carers UK, these top 3 priorities always come out: understanding, flexibility and information. So absolutely top of the list is this recognition from the organisation or your line manager about what you mean by caring, about your situation. Flexibility, the top 2 things that get asked for are flexible working arrangements and flexible leave. And information as well, signposting to information and support both in the workplace and outside. So it's really interesting that those 3 priorities in all the research and polling and other work we do haven't really changed over the years. Say a little bit now about legal rights for carers at work. So this slide, I'm not going to talk through it in detail, it's there really for reference, but just summarises all the rights that are relevant to carers. And some, of course, include others, not just carers, but they're all significant. So right to time off in emergencies to care for dependents, parental leave and shared parental leave, which can help you whether your child has a disability or you're balancing childcare with perhaps elder care, but just having that wider time with your family can be really important. The right not to be discriminated against or harassed because of your association as a carer with disability or age. The right to request flexible working, which, as I think we'll all be aware, has been enhanced. So from 6th of April, this is now been revised and is now a right from the first day of employment. So those arrangements have changed and it's a bit more open and flexible. So that could really help support lots of people in caring situations, including those that are looking to join work and join employment. And then critically, the new right to take up to a week's unpaid leave to care, introduced by the Carers Leave Act 2023. So I've just got a slide here just summarising the Act. I think hopefully most of us on the call are familiar with the main provisions, but just summarised it here, that it's 1 week's unpaid carers leave for employees to provide or arrange care for a dependent with a long-term care need. So quite a broad definition. So it amends the Employment Rights Act. It applies currently to Great Britain, i.e. England, Scotland and Wales, because Northern Ireland, there the powers are devolved, but we're waiting with bated breath with Northern Ireland about what's going to happen, whether they're going to do this or go beyond. So watch this space. There's very similar rights and provisions offered here as by other family leave entitlements. So, you know, rights in terms of your protections while on leave and things like your terms and conditions of employment remaining while you're on leave. I think, as we'll all be aware, this came into force on the 6th of April, so this session is very topical. Government guidance is on gov.uk at the link there. So to say a little bit about the Act, so key definitions, because we get asked quite a lot about this. So it defines dependent in a way that aligns with the statutory right to time off for dependents in emergencies, and it's a very broad definition. It also defines long-term care need very broadly, so covering a dependent who either has an illness or injury requiring care for more than 3 months, or has a disability, so a very broad definition as covered by the Disability Discrimination Act. It's really, really broad, or requires care because of old age, so any one of those things. So it covers really, really wide situations. Providing or arranging care isn't defined, but the intention in the law is to cover this wide range of situations, including arranging care for the future. So it's a really interesting new provision, which is very broad. Questions we get asked. I've just got a couple of slides on some of the key questions about notice or evidence. So the notice period is a similar process to annual leave, and notice must be given by whichever is the earlier of twice as many days in advance of what you're asking for, or 3 days in advance, so whatever's the earliest of that. No evidence is required to support a leave request. So this is explicit in the law that carers don't need to give evidence. So therefore, employees will need to self-certify that they are caring for someone with a long-term care need, but they're not required by law to provide evidence of this. So one of the key questions that comes up to us is, well, how do I know if my employee is a carer? You know, who are carers in our workplace? And I think even employers that have been providing carers leave often find that challenging, that they know there's people in their workforce, but they're not necessarily visible as carers. So just sort of 3 key, very basic threads that come out of our work with employers about starting the conversation in your workplace at all levels, so organisational level, at team level, and at one-to-one level. So promotion campaigns within your organisation more widely, awareness raising through team meetings, encouraging line managers to talk about caring, raising that as part of business as usual, really, in team meetings, in the same way as we might support parents, and also encouraging sort of support and listening ear of line managers in one-to-ones, making it part of the conversation. Just another question before I move on to just a little bit about employers for carers. So how does carers leave interact with other types of leave? So as I mentioned earlier, carers leave is for planned commitments. Unforeseen caring situations are already covered by the statutory right to time off for dependents in emergencies, so this is complementary. Carers leave is also separate too, so comes on top of rights like parental leave, rights for a parent of disabled child, so all of these rights are complementary. Carers leave can also, of course, be enhanced by employers, and some are already offering paid leave and or additional unpaid leave, days of leave. And we think the really good thing about the Carers Leave Act is it will be a baseline with hopefully a trigger for many employers to go above and beyond. Just to finish with a little bit about employers for carers, so I think, as many of you may be aware, it's Carers UK's business forum, very much informed by business and employers. We've developed it with business and employers over a number of years, supported by our knowledge at Carers UK. We now have around 230 member organisations from different sectors, public, private, not-for-profit sectors, representing around 3 million employees in the UK. And we provide practical support for employers to develop carer-friendly workplaces. And employers provide that for each other. It's very much a forum of member-to-member exchange of good practice and tips. And you know, we learn a lot from Carers UK, very much a two-way learning process. And as part of this, it promotes the business benefits of supporting carers. Employers have stayed with us because they realise it's not just the right thing to do, it makes absolute business sense in terms of retaining and supporting your employees. And it also helps to influence employment policy and practice. The work of employers for carers helps to inform our campaigns at Carers UK, our evidence about what works for working carers. So just a little bit about what helps in the workplace. I won't talk to this in detail. It's there in a nutshell. our 5 Ps. These 5 Ps have been very much good practice that employers have reported to us, things that really work and things that working carers tell us help. So preparation, enabling carers to identify themselves, policy and guidance, making your support transparent. You know, you might have great policies, but are you saying that they're relevant for carers? Practical support, practical adjustments, health and wellbeing support, things like that. Peer support, helping carers to connect with each other in the workplace, maybe through support groups or networks or carers champions, and promoting support, of course, communicating this to and for carers regularly. So we have, as part of our membership service, a platform, a dedicated platform, EFC Digital, and organisations that are members can link up to that, just create their own unique membership, their own password, and access it anytime and make it available to all of their staff. So we have lots and lots of support on the platform, including things like e-learning, toolkits, guides, case studies from other employers, and practical toolkits, for example, around having the conversation, starting the conversation. So that, for example, has been very much driven by practical tips from employees and managers. We put them all together in one toolkit, and we've got a sort of little script, like a template script, to help prompt the conversation. And again, that's really from suggestions from our member organisations. Just to say a little bit about resources for carers as well. So Carers UK provides not only lots of information on our website for carers to access, but also new and innovative ways for carers to connect with each other, but also connect with sources of support. So, for example, including our jointly care coordination app, which enables you to create a sort of caring circle to help you manage care and provide really practical support, particularly when you're busy working carer. So just really a screenshot to show you all the sorts of information we have on the Carers UK website. And just that's just a really summary of our membership benefits that employers for carers for you to have for future reference. And I just mentioned there that this includes a discounted entry to our benchmark Carer Confident. We know that several NHS organisations have taken our benchmark, and it's a 3-year benchmark which provides a practical framework for you to develop and sustain good practice. And those 5 Ps that I mentioned earlier are the sort of criteria that have helped, they're the criteria that we use in our benchmark to look at good practice. So it's all very much based on the real experience of employers. And I've given you a few Ps earlier, so I'm going to finish with the business benefits and some Rs here. This is what members have reported to us around improved recruitment, improved retention, improved resilience, and improved business results. So as I said, it's not just the right thing to do. Employers are recognising it makes absolute business sense for them as well. So just also to say here a slide really for carers anywhere in the UK to get in touch with us. We provide free information on our website. Support from our helpline there. It's open Monday, Friday, 9 to 6, and an advice email as well. And we have online meetups which are free for carers to register to join as well on our website. And just also to highlight our all-in-one place looking after someone guide for carers. That's just a shot of our website with all the sorts of information that we cover, every aspect of life really, for you as a carer. I'm going to just finish with our contact details there. So both for employers for carers and how you contact us there, including my colleague Emily, who's on the call, and also Carers UK and our helpline. So I'm trying to keep as quickly as much time as I can. Thank you for listening, and I look forward to staying on for the questions later.
Oh, thank you so much, Catherine. That was fantastic, really interesting and informative. Yeah, good to come back to you with some questions later.
Thank you.
Thank you. So we'll move straight on to our next presentation, if that's okay. We've got Roz Jones from the Northwest to talk about your working carers paper, and I think Sigrid's here as well from the Northwest. Hi, Sigrid. Are you okay to start now? Yeah.
Yes, no problem.
Wonderful.
No problem.
Thanks so much.
Thank you. Thank you very much for inviting me to share the Northwest NHS England case for change for working carers. This is integral to the delivery of obviously the people and workforce strategies, and within the Northwest. This is a programme that is being initiated through the Best Place to Work programme, which is initiated to embed a culture of positivity, inclusiveness and fairness within the workplace. We'll go to the next slide. Thank you. Obviously, we've covered the definition in the previous presentation, but I'm no expert on this. I've been asked to do a dedicated piece of work, but as part of doing that, I actually realised that I am actually a working carer, and I'm one of those people that hadn't realised for a good couple of years that actually there was a definition towards that. So yeah, so it's quite enlightening to actually find that out. So next slide, please. So just a little insight into my world. I want to introduce you to my parents, Norma and Bill, both in their 80s, married for 63 years, both healthy lives up until just before lockdown, and Dad was diagnosed with vascular dementia. Mum was mainly the main carer, and I supported with my sister. Fortunately, I don't actually have any dependents and I live alone, so it was really easy for me to actually be able to go to their home in Wales and move myself to work from there at times of need. So flexible working and home working was actually really good at the time. I felt really supported by my line manager. She did actually have lived experience, so I was extremely lucky, and I know that's not always the case. So very flexible, was very trusted, and I was actually able to navigate through this. It didn't happen overnight because obviously Dad was going through the stages of dementia. It was like a sliding scale with everything coming my way. Running the house, doing the finances, and the last 6 months were obviously more intense. I had to take special leave because we had hospital episodes, and then Dad sadly passed away Boxing Day 2022. So the attention now is on Mum. We're just navigating a move to Cheshire from Wales, and lots of things that go with that. So she's relatively independent at the moment, but there's still an awful lot to do. So I don't think you can underestimate the hidden challenges that this all brings. Next slide, please. Next slide, please. Thank you. So why the focus on working carers? Some of this is actually, the slide before. So some of this has already been touched on. So obviously around making employees feel safe and valued at work so they can bring their best self to work. Mitigating any pressures that come from the changing workforce. We've got fewer entrants coming into the job market, later retirement ages, latest pension ages, and also the demographics of the population are changing. So people are living longer, but maybe the quality of life isn't as good, and public sector budgets are reducing, so the support within the community around caring actually ends up with the families and friends, because that community care isn't as good as it should be, really. There's been touched on the previous presentation, touched around the inequalities, and one of the things that I didn't realise was that carers on average can retire 8 years earlier than their non-peers. So, you know, really need to have a focus and understand individuals, what support individuals need. And then I'll come on to the opportunity cost of supporting a carer to actually stay in work, because there is a knock-on effect, not just from an individual perspective, but from an organisational as well as a system perspective. Next slide, please. I won't go into the Sorry, I won't go into the legislation because that's been covered. What I can say is that NHS England do actually support both the flexible working policies and also the special leave policy is paid. And at the bottom of the slide, it just mentions around the associated discrimination, which has already been covered. Next slide, please. So what does NHS England North West region look like? So we employ 839 people, 810 of those are permanent contracts. Based on the ratios from Carers UK, it is higher within the NHS, it's 1 in 5, and this equates to 162 working carers, but from information sought from the NHS survey, it actually said 1 in 3. So what I've taken for this piece of work is a range between 162 and 270 working carers. So looking at the January HR data, it did actually highlight that within the Northwest, we do actually have a higher number of carers compared to the English average. Now, that could be that carers are recorded more, or we have actually got more carers. So, but it's just an indicator to be aware of. Within the our employees, we have 13% of BAME background, 5.2% LGBT and 11% disabled, and 71% of those employees are female. So 2021 census data evidence that significant correlation between deprivation and the likelihood of becoming a carer, and also year-on-year GP survey data provides evidence for poorer physical health and mental health outcomes for carers. And Carers UK shows that 44% of working age adults who care 35 plus hours are more likely to have a poorer physical and mental health outcomes. And sorry, I've got stuck there. So 35% plus hours of working are in poverty, and BAME carers are more likely to struggle financially. So there's lots of information there around what we need to be aware of and how to avoid those inequalities so that we give that support. So many female, many of the workforce, the majority of the workforce are female, and those females are actually working at a grade band 7 and 8A, and 41% of those are supervisors. So a lot of knowledge and expertise within the organisation. So it's really important that we around recruitment and retention, and making sure that people are resilient to stay in work. And 45% of those female employees are aged over 51 years, so likely to be going through the menopause as well, just to add onto the pressures. Next slide, please. So what support do we have at the moment within NHS England North West? So the role of the working carer was introduced a decade ago through Commitment for Carers, as well as Employees for Carers since 2021. We've talked about meeting the legislation and also around the Best Place to Work initiative that we have. So that's really driving forward at the moment within the organisation. There's the National Carers Network, which is a wealth of knowledge and peer support. The soft intelligence within that network is fundamental, and I picked up a lot of things through the work that I probably would have missed, to be honest. And there's been a universal passport that has been developed, which is something that an employee can actually take right the way through their career, share as much information as they want with their manager, and it's about having those adaptations that are required, but you don't have to start again every time you get a new job. So that's like fantastic. Next slide, please. So what needs to be strengthened? when I was looking at this, I thought, gosh, there's so much here and it's really good. But when you start to listen to people, you realise that there are a few areas that do need to be addressed. And the culture within the organisation really needs to shift so that people are listened to, people feel safe, and that they are happy to declare their position. That's something that came up in the network. People were not comfortable to share their position. And also it was evident that the quality of decision making was inconsistent across directorates, and previously, historically, there had been management training for line managers, but that had been decommissioned. So that's something that probably needs to be looked at and reinforced. The communication strategy needs to be developed, and a lot more sharing of information around lived experience helps people to understand that they're not on their own and that they can learn for others, and there are other peers that can help to support. And support for working carers need to be evaluated. There was nothing that I could see that really captured the intelligence within the organisation to learn from. So we've got staff surveys, we've got lots of information from the network, and we've also got exit interviews from staff, and none of that was being cross-checked and to be able to look for continual improvement, and a move away from short-term thinking and viewing from different lenses. Next slide, please. So with a commissioning background, like to look at different things. So looked at the opportunity cost of from a position of those working carers, and so based on the 162 to 270 working carers, and taking the Carer UK estimate around the cost of the employer leaving work is equal to their last salary. I looked at an 8A midpoint with on cost. So it was approximately just over £5,000. So if we looked at that for the Northwest region from an organisational perspective, that ranged from just under 900 to 1.5 million, which was the cost of an employee leaving work. So from a systems perspective, Carers UK have also evidenced that one carer saves the economy £19,000. So looking at that, if a carer did not stay in work or couldn't care, and that care needed to be delivered within the community, that cost would be 2 to 3.2 million. So the potential overall saving is just under 3 to 5 million if working carers stay in work. So that's a real strong message going forward from lots of different angles on that. Next slide, please. So just to sum up really the recommendations that I came up with. So what I've said is around executive champions. We need to have executive champions on the Northwest board and nominated champions within each directorate. We need to be aware around the protected characteristics and around associative discrimination, and ensure that does not take place. Training for line managers needs to be introduced and possibly needs to be part of mandatory training, not just for carers, but I think about being compassionate with anybody that has got any needs to be supported in work. Inclusive policies, making sure that they're actually meeting the needs of the employee and the organisation, and also around really driving forward this best place to work culture and around positivity, inclusion and fairness. Next slide, please. And the last few around communication strategy, around strengthening that, and also around making sure that we are involved in the National Carers Network. And as I mentioned before, about establishing a key set of indicators to measure awareness, inclusion, engagement, and note the cost. It's not a small cost. If we move away from short-term thinking, things might start to change. And ultimately to become a best practice employer and work through to achieve the Carer UK carer confidence levels. I thought it was a really good benchmark to be able to work towards, you know, to be able to benchmark yourself as an organisation, and over time to work towards those levels. So the work has actually been endorsed by North West NHS England Regional Management Team. It's a key work programme for this financial year, and it's at the stage of implementation. We haven't done the plan yet. We're just at the end of a massive organisational change. So we've got new managers coming in. So it's just getting that appropriate time to then take that forward. And I think we've got a real opportunity as we move into the organisation to really get this on the agenda. So I hope I haven't gone over time. That's it. Thank you.
No, not at all. We've not gone over time. Thank you so much, Roz, and thank you for sharing your personal experience as well. And I think really demonstrating, as Katherine said in the first presentation, the importance of that, the flexibility and the support that you had from your manager and the difference that made to you. So really appreciate you sharing that. Thank you. There's been lots of interaction. I don't know whether either of you, the presenters, saw, because you were busy presenting, but lots of thumbs up, lots of hearts, lots of claps. So I think people have really appreciated those presentations, and I certainly have. And some comments in the chat if you do get the opportunity to have a look at those. So we'll move on to any questions, if that's okay. So anybody got any questions or observations they'd like to come in with at this point? Any discussions? Thank you, Joe.
Hi everyone. Yeah, two great presentations there, and Katherine, for some reason it won't let me email you, and I think it's because it's KE on the email
yes,
rather than K.
Yes,
right, okay, that's great. For Ross, thanks so much. That's kind of halfway on this journey myself, so I would really appreciate if you and I could meet up outside of this meeting, because we're just in the throes of scoping out in South Yorkshire what our response is going to be, given that I only came into play properly on the 1st of April, but very much being part of the carers situation. So I would really appreciate that. And Katherine, yeah, we're in a position now to move forward with the things that we've spoken about before. So to both of you, thank you so much.
Great, thanks, Jo. Any other questions, comments, observations? Or Gemma?
Hello, hi. Yeah, brilliant presentations. Thank you. Really, it's really great. And I'm in a very similar situation professionally and personally. So it's yeah, really helpful to have those kind of summaries of everything that we can then take to others as a mandate. I guess for me, and I don't want to bring anything down, but it's the financial situation we are hitting at the moment is just so hard. And I think it's how we can galvanize the awareness of, I think you put it as the short-term thinking. So think bigger. We need to be clear that if you support carers, it makes a huge difference to the whole system. Whereas if we, look at cutting services, and particularly within our Better Care Fund world, it's a real pressure at the moment. So I think we need to have a loud voice about how these services and supports are essential rather than a nice add-on to the NHS. But yeah, that was really my sort of comment on it. But thank you very much.
Thanks, Gemma. Really appreciate that. Any other comments or questions?
I can maybe just make a quick, if no one else is, just make a quick comment after what you said there, Gemma. Very important and actually very topical. I've just seen that Carers UK just now has launched our recommendations for the political parties for the manifesto, for all political parties about what Carers UK is calling for. So one of the things is investment in social care to improve carers' health and well-being, giving them a right to a vital break and also giving them the space to juggle work and care. Building on the new right to unpaid carers leave by making it a paid entitlement and extending it to 2 weeks of leave, because we know that many carers can't really afford unpaid leave. I mean, it's great to have it because we didn't have it before, but also interestingly, making the NHS the most carer friendly in the world. So that's a nice aspiration to have as well.
Thanks so much for that.
It's on our website now, so it's just been launched, so it's very timely.
Yeah, oh, great. Thank you so much for that. I'll just have a quick, I don't think there's any other questions in the chat, Steve, is there?
I think I just saw one about the Carers Leave Act. So yes, about the title. So it is officially the Carers Leave Act 2023 because it received royal assent last year. But there are also Carers Leave Regulations 2024, which are part of the legislation to put some of the Act into practice. So the answer is it's Carers Leave Act 2023, but the regulations that enact parts of the Act are the Carers Leave Regulations 2024. So there's a bit of detail there, but that's how it's been published on the government website.
Wonderful. Thank you. And Gemma?
Sorry, Roz, I just really wanted to know if you did have a kind of a dedicated budget around this. I mean, do you have particular funding around how to make all those recommendations happen, or is it being built into the system, as it were?
So I haven't as yet. I was going to put something together to say what was required, but I've got a new manager that's literally just started, so I'm going to talk to her and see what it's been endorsed by RMT, but not there wasn't a budget associated with it. But I think we need to look at how that's taken forward, because it is hard when it's on top of the day job. Yeah, so it hasn't as yet, but yes, it is something we've talked about.
Thank you both. Jo?
Just as a pointer, Gemma, that might be helpful is because the statutory obligation sits with the local authority, we have a joint strategic approach to this. So we feed into that to make a joint approach, and from an integration agenda. What we also have started to do within South Yorkshire is to make them look at the fact from a workforce point of view, what the implications are. And if you're going to do this for your workforce, why would you not do it for the wider community anyway? So it's that real, if you look at the integration agenda, it lends itself to saying we need to tackle this. But as I say, we're taking the route through local authority initially, but actually we're looking at it from a workforce point of view as well to get the investment put into it.
And I think that's, I think definitely spot on. But I think to choose my words now, so it's being recorded, but I'm local authority. I work very closely with my NHS colleagues who are absolutely brilliant in Sussex. But I think the problem is the more pressure we've got on budgets, the less integration of funding is happening. Because everyone's got their own pressures, and so that's the issue for me. I think is that we're sort of everyone's shrinking away from a shared approach. But
so what we're doing is looking at the health cost benefits.
So
we're saying definitely. If you don't come together, you actually the inefficiencies within the system. If you identify them, it's a long job. It's not something I enjoy, but it's kind of, you're right, and unfortunately it is to do with funding. What do we have? What capacity do we have? But actually there's a lot of capacity in the system if you unpick it properly, which is a long job, but then it's your capacity to look at that as well. But jointly they're making a edgeway in it.
Yeah, and I think going back to Catherine's point as well about the manifesto, I had an email alert on it just before this meeting, and was really pleased to see that push for a new national carer strategy, because I think that again gives us something to hang all of this on to, which possibly would produce funding as well. But that ability to be really clear about what is a priority at a national level, as well as trickle down into our priorities as LAs and as NHS ICBs.
I think, Rachel, as well, there's a space here for, without wanting to be too political for obvious reasons, but there's a lobbying element to us. And I think that if we could think about this as a whole, the whole group, to kind of say, right, we do feel this is a need. this is why we work in this space. I'm not sure whether we could do some type of position statement together to say, look, you're coming into, if you want to win votes. Now, from a Department of Health and Social, that one me being sarcastic, it's not my first rodeo. It's just in terms of what power we could have an influence on those decision makers, and I think it would be quite pertinent for us to possibly be able to do that.
Yeah, and I guess that the work that we're doing individually and collectively, you know, is work that we are raising that priority through, you know, that day-to-day recognition of how we really need to work together and support this, and what we can do individually and collectively to raise the profile. Absolutely. And I think for me, just an observation that's really struck me right the way through the presentations, starting from the point where you said, Katherine, that 600 working carers are leaving work every day, and that's really struck a chord with me, because I knew that was an issue, but when you say it like that, it really makes me think, and about the need for that organisational culture and that safe space within organisations and openness and support to really encourage people to, you know, speak about their carer role or identify themselves as carers. And I think that's absolutely crucial. And I think that's why today I think is so powerful, because I think it's touched a chord with a lot of people. And I think it is definitely incumbent on all of us to do what we can to raise a profile. Absolutely. Any other questions or observations? And I think lots to think about for all of us. Oh, and Ellie, do you want to quickly mention the post that you've just popped in the chat?
Yeah, I was trying to quietly get it in there in the background.
No, come in, don't be quiet.
I just wanted to flag, listening to some of the conversations, I know it's not sort of directly carers related, but it may or may not be of interest to this group, that we also have Experience of Care Week coming up at the very end of April, going into early May. And I've just posted the sessions there. There's one particular session around digital carers contingency planning from Roz Spinks in the London region, but there may or may not be other sessions of interest to you. So do pop on and have a look, and feel free to book on anything that is of interest.
Wonderful. Thanks, Ellie. Anything else anybody wants to say or comment on? Oh, thank you, Sigrid. It's a really helpful link from Sigrid in the chat around unemployment. Who are the millions of Britons not working? Oh, Anna, got your hand up?
Yes, slightly different topic, but still perhaps of concern. So I work for Cambridgeshire and Peterborough Foundation Trust, and we're obviously covered by the Integrated Care Board at Cambridgeshire and Peterborough. And they have declared that they don't have capacity to focus on carers, and therefore I believe are no longer paying for the subscription for Carers UK. And I just wondered whether there's any kind of potential in terms of highlighting this as an issue of concern with the ICB. We have raised it, but again, they're clear that while they will support the county council's work, they're not focusing on carers, which feels from a health perspective a real position of concern.
In terms of sorry, Roz, did you want to come in?
So I was just going to say that's where the opportunity cost and that economic lens is quite helpful, because then you can start to demonstrate, because I think like anything, a lot of these things are looked at in isolation and it's so short term. So by demonstrating the case, and you can just use exactly what I've done and replicate it for your areas and do it by ICB area. And I think you know, that's part of it. And as Joe said about looking at the efficiencies in the system, because not everybody has that wider lens. So I think that's really one way that you can maybe get that message across.
No, thanks, Roz. And I think we've talked about the efficiencies and the kind of across the system in relationship to that. And we have been able to move forward in terms of we do now have a outcome related to carers for primary care, but in terms of actually having someone within the ICB to really champion and to work on a really clear kind of agreed work plan for carers across the system, we have not been able to move that forward.
Okay. Jo?
No, which area do you belong to, sorry?
Cambridgeshire and Peterborough.
Okay, so within South Yorkshire, I am that person that works within the ICB and has kind of got that in my portfolio. So if you want me to speak with others and influence for you, I will try to do that. But I come at it from a workforce point of view, which seems a wee bit strange, but it's the only way in order to be able to, as Roz is saying, is you have to make your case. And I'm more than happy to support you to go and speak to the gods and say, do you realise what this would, do you realise the implications? Because I think there's so much happened in the ICBs recently that it gets lost at times. So it's about making people re-see the importance of doing it, but happy to support you.
No, that's great. Thank you. And thank you, Roz. I'll pick those details up.
And Anna, just because my geography is not amazing, does your ICB sit within the Midlands region?
No, it's in East Anglia.
East Anglia, okay. Because I know obviously at regional level there's been some changes as well, but I can have a quick chat with Sian and just see what links there is within regions.
That would be great. That would be great. Thank you.
And just highlight. Okay, thanks so much for that. Gemma?
Yeah, it was just to add that I think if that the work Roz has done absolutely brilliant, and that ability to replicate some of the data across our own areas is really helpful, and also potentially to build into that some of the more health inequalities data around carers, which is so powerful. Which we have, at a national level and at a local level, because it really does show, particularly women of my age, we are those who are going to have skeletal muscular issues from caring. We're going to have hypertension from caring. We're going to have the impact of menopause and caring. We're most likely to be on antidepressants. It's huge, the data out there, which I think when you start to really put that as a list of issues, it's very hard not to take on carers at an ICB level. And it's an interesting challenge to what they can come back with some of that, really. But yeah, I feel your pain.
No, that's great. Thanks, everyone. That's really, really helpful and given me some more ideas about how we can champion this at the ICB level.
Yeah, and I think that, the new NHS operating framework, where we've all got to, I think creatively and differently about how we can raise the profiles of these types of issues. So I think for me, this is why these types of forums are so important. So if it's okay with everyone, I'm going to draw us to a close. I'm just going to thank Steve, and ask Steve if there's anything I've missed.
No, I was just going to add, Harriet's just added a good point in the chat box to link Anna with the regional lead. I think for your region, Anna, that will be, I want to say Jodie, but we've got a new regional lead. Yeah, so
yeah, that's what I was going to say, because we can speak with Sian, because I know Sian's got, because I'm not 100% sure for the East of England, but yeah, definitely. Thanks so much, Steve.
No worries. And just to add that our next session will be on the 15th of August, and that will be the Young Minds Parents helpline information session, and that will be between 10 and 11. So I'll be sending out further details for that one.
Thank you. And thanks so much to our presenters. A really great session, and we really appreciate you taking the time to all come along. We'll hopefully see you in August, if not at one of the Experience of Care or Carers Week events coming up soon. Take good care.
Thanks very much. Thanks for inviting us at
Everyone.
Carers UK. Thank you.
Thank you.